We chose the theme today, Accelerating Health, for one reason. The amount of data and new technologies available to us are snowballing, not year by year, but minute by minute. Today, every minute, 48 hours of video are uploaded to YouTube, and almost 700,000 updates are posted to Facebook every minute. Data is collected at every moment in our lives, from our phones and our credit cards, our televisions, our computers. Data doesn't just surround us, it is us now. It is defining a new way of thinking. But how do we harness it? Or do we even try to harness it? How do we channel it to improve health, to build equity, to save lives, and to save money?
All aspects of data management, and analytics that provide greater predictability and better quality are some of the biggest challenges and opportunities faced by healthcare today. PHI, in celebrating its 50th anniversary, not to just have a big party tonight, but really to hold this educational forum to increase the dialogue, as Mary suggests. It's something that's extraordinarily important, both from the public health perspective as well as the provider community perspective.
The open data movement, stimulated by consumer demand and federal directives, still challenges us, as barriers remain for getting access to government data sources, where some see their roles as data guardians and making data increasingly difficult to get to. We need to be able to get data at a granular level so that the razor's edge precision symbolized by removing the Broad Street pump handle can be the hallmark of this work. Data allows us to discern opportunities. Innovation supports us to actualize them. The population health perspective is how we make this work important to everyone's families and communities.
The marketplace requires it. Our patients deserve it, and our providers are trying to keep up with it. And so we've got everybody striving to do the best that they can with data.
How we're using some of these experiences of capturing data in the public health realm and merging that with some of the critical care and acute care medications to actually look at where we want to go with going from data to the analytics to knowledge to actually wisdom. And from that wisdom, it basically drives recognition of our own humanity, which starts the cycle all over again. And so really those who can gain the most and learn from the experience the fastest are those that adapt the fastest.
Health happens between doctor's visits, but what happens in between is largely unknown. And that world is starting to change. And we think the most powerful sensor of all is actually the smartphone. There's 4 billion of them on the planet. The distinction between smartphone and dumb phone is largely going away. Take advantage of this incredibly powerful sensor and turn it into a proxy of health state. That based on when you unlock your device, we can approximate how much you've slept. Based on how much you're communicating, who you're communicating with, rough approximations of those patterns. We can start to approximate your social isolation. So let's say if you have depression, really understanding how you're changing behavior in ways that we would have never fully appreciated.
Even corporations have begun to realize that it does pay to sort of pay attention to public health, especially in a healthcare system that is now emphasizing population management, better health, keep people healthy, and overall there's lower costs associated with that. I think that that's a message that can now begin to resonate with a lot of different parts of the healthcare system. And the biggest item that we sold in the front store in terms of revenues was cigarettes. So there's no way to use them even in moderation. So it didn't make much sense to be selling those at a pharmacy, and especially a pharmacy that was trying to sort of show its orientation towards healthcare. So we decided that we would get out of cigarettes last February. We announced that. And then just this past couple weeks ago, a couple months early, we got all the cigarettes out of the store. So that's about $2 billion. Thank you.
The California Department of Public Health was the first of the California Health and Human Services departments to create an open data portal. And we just launched on August 8th. But that was a landmark day for California. And to start open data with health data, I think is a really big deal because it is scary for leadership. So open data is really just about making data usable. You've heard from everybody that there's lots and lots of data out there, but there's also a lot of data that's not usable. And I think you know that we're all kind of interested in sensors and data and information, but now we're going to have to do something with all of that data. And I would say 90% of that data is geographically relevant. And so we can learn a lot about place. And I think geomedicine is really a step in the future of where we can go with personalizing healthcare to your individual needs.
Public health has always been about data and evidence, so this isn't new. But what we have to do is figure out how we're going to apply the data and evidence we have. We can have tools to predict who's going to become sick. We can identify environmental triggers for asthmatics, but we haven't yet put that into the mainstream. I hope you all leave today thinking about how we can work better together across boundaries to maximize the potential of the new world of big data.